We pray for them, we do things to make them feel comfortable, we try to ease their fears and anxieties while still maintaining honesty and trust. We celebrate every sign of improvement with them. We try to honor their wishes, and we grieve for them and their families. The hardest part is the high number of patients that die every day, per week, per month, despite everything that we're doing to save them. This has taken a toll on the staff, and no one can really understand that unless you're in the trenches caring for these patients. This virus is not just affecting the elderly. We've intubated patients in their 20s. We've had patients die in their 30s and 40s, leaving young children at home. Some COVID patients who die don't have any comorbidities putting them at risk, and some who do have extensive comorbidities are asymptomatic. This inconsistency makes this virus very confusing and frustrating. We spend several hours with our patients each week, so we get to know them. We listen to the stories about themselves, about their families, their work life, their hobbies, their pets, their concerns, their fears, and their wishes. Several have spent birthdays with us. Just last week, one family sent a birthday cake for their mother. She was intubated later that day, and she passed away later in the week. We had a dad who never got to see his young children again after he was admitted. He died without getting to say goodbye to them. There are too many stories to tell, too many patients that have died, but we also have success stories. The oldest patient we have extubated and lived is 80 years old. I've worked with him extensively. He was barely able to sit on the side of the bed with a lot of help because he was so weak and his oxygen demands were so high. But by early the next week, I had him ambulating in the room on a walker and down to 30 liters of oxygen with mobility. I began seeing patient on the ventilator. She had been on the ventilator for nearly 2 weeks. Eventually, we were able to get her extubated and home to her husband. It was a day we truly celebrated.